Everything you know about ancient medicine is a myth. Turns out, thousands of years ago, humans performed brain surgery, and the patients actually survived. Studies show their ancient healing methods still live inside your immune system today. Imagine you're living in a cave. Your fever spikes, your throat burns. There is no doctor, no pills, no hospital down the road. Just stone, fire, and the people sitting beside you. What do you do? How do you survive the night? Most never stop to ask, but the answer changes everything about being human. Their first cure wasn't a plant, it was stranger. Sickness is older than our species, older than language, older than fire. Long before humans walked upright, bacteria and parasites were already shaping the bodies of our ancestors. Every creature ever born faced one puzzle. How do you survive when something invisible eats you from inside? Scientists believe disease has been our oldest and most patient enemy. And strangely, our oldest companion too. But here's the unsettling part. The same instincts that kept a Neanderthal alive are firing inside you right now. When you shiver, when you crave sleep, when you reach for honey or tea, that's not modern habit. That's ancient software written before agriculture, before cities, before writing. Your body remembers what your mind has forgotten. We know this because of bones, teeth, tiny fragments of plaque scraped from skulls 40,000 years old. Archaeology has become a strange medical record. Each healed fracture a story, each worn tooth a tiny clue. But one skeleton broke the whole story open. In a cave in northern Iraq, archaeologists found something impossible. A 50,000-year-old man who by every rule of survival should never have survived childhood. His name in our time is Shanidar I. He lived in what is now Iraq. He was a Neanderthal, and he was, by any reasonable measure, a wreck. His skull was crushed, his right arm withered, possibly amputated. His leg had broken and healed crooked. He limped. He could not hunt, fight, or feed himself alone. And yet he lived, for years, maybe decades, into what was, for a Neanderthal, old age, impossible without help. Someone brought him food, someone tended his wounds, someone shared fire with him when he had nothing to offer. Contrary to popular belief, the brutish caveman stereotype collapses under the weight of his slowly healed Neanderthal bones. Shanidar is not alone. Across Europe and Asia, archaeologists keep finding skeletons of people who survived impossible injuries. A toothless man lived years on soft food someone prepared. A deformed child was buried with obvious care. A woman's broken pelvis healed in ways revealing months of immobility, constant feeding, and patient hands tending her. This is the first ancient medicine. Not a drug, not a spell. Just people deciding you were worth saving. Studies show that simple nursing care, warmth, water, food, and rest dramatically raises survival from any infection. The tribe was the first hospital. Compassion predates agriculture by tens of thousands of years, but care alone doesn't beat infection. So what did our ancestors actually use to fight the wounds that should have killed them? The answer was hiding in their mouths. In the 1920s, scientists began scraping hardened plaque of ancient teeth, at first just to study diet, but around 2015 the technology improved, revealing molecular shadows in dental calculus. Suddenly they could read traces of plants chewed 60,000 years ago, and what they found rewrote the story. In one Neanderthal from El Cidrón in Spain, they found yarrow, bitter, useless as food, but a powerful astringent. Yarrow stops bleeding and fights infection. They also found chamomile, a sedative and digestive aid. Then came poplar bark. Poplar bark contains salicylic acid, almost exactly the active ingredient in aspirin, nature's painkiller in a Neanderthal's mouth. Thousands of years ago, someone noticed this particular bark eased pain. They remembered, they told someone else. Knowledge survived. Generations without books, without schools. Pure oral memory, polished by trial and error across 1,000 grandmothers. That is pharmacology before pharmacy. Then there is Ötzi, the Iceman, frozen in the Alps for 5,000 years. When researchers thought him out, they didn't just find a man. They found a medicine kit strung on leather. In his belongings was birch polypore fungus, carried deliberately. It is both antiparasitic and antibacterial, a serious remedy. When scientists examined Ötzi's gut, they found whipworm eggs. He had a parasite. He was carrying the exact cure. He had tattoos too, dozens of them, small lines and crosses, etched into skin with soot. Nobody understood why. Then researchers mapped them. They cluster on his joints, lower spine and ankles, exactly where he had arthritis, exactly where modern acupuncture points sit. 5,000 years ago, someone treated chronic pain with needles and ash. Plants and tattoos were only the beginning. Then someone picked up a sharp stone and aimed at a skull. Ancient medicine gets disturbing here. Imagine you're lying on the ground, head pounding. You've been having seizures and visions. Maybe you took a blow to the head days ago and never quite recovered. An elder kneels beside you. In their hand, a flake of obsidian, sharpened to a razor edge. They start to cut, not skin, bone. They are drilling a hole straight through your living skull. This is called trepanation, and it was everywhere. Trepan skulls turn up in France, Peru, China, Russia, the Pacific. Thousands. The earliest are 7,000 years old. Some scholars think it's older still. The oldest documented surgery in human history. And here's what stops you cold. Patients survived. Not all, but a remarkable share. In Peruvian samples, over 80% of holes show healing, bone regrowth, smoothed edges. The person walked away, cooked dinner, lived for years with a window in their head. Some skulls show multiple trepanations, all healed over time. Repeat customers, thousands of years before anesthesia even existed. Why did they do it? Probably for many reasons. To relieve pressure from injuries, treat chronic headaches, stop seizures. And scientists believe sometimes to release trapped spirits. Sickness wasn't always physical to the ancient human mind. A migraine was a thing inside the skull that wanted out. So they opened the door for it. But trepanation wasn't the only surgery. Evidence of dental drilling appears at a 9,000-year-old site in Pakistan. Tiny perfect holes bored into molars with a flint tip, possibly to drain infection from inside teeth. There are skeletons with healed amputations, suggesting controlled cutting and cauterization. Mummies wrapped with carefully sutured wounds. Splinted bones set straight enough to function again. Surgery is older than writing by many thousands of years, and these surgeons had to handle pain. Without modern anesthesia, they used what nature simply gave them. Opium poppy traces appear in Neolithic sites across Europe. Coca leaves were chewed in the high Andes. Cannabis residue has been found in ancient burners. Alcohol was brewed early and often by every tribe. The first operating rooms were dim caves, lit by fire, scented with smoke and herbs, and human fear. And yet, the real healer in the tribe wasn't holding a knife. The real healer sat by fire. Singing. In almost every ancient culture we can reconstruct, one figure stands at the center of medicine. The shaman, the medicine woman, the tribal healer. Doctor, priest, and pharmacist housed in one single body. They knew which plants to brew, they knew which bones to set, and they knew something far subtler. They knew how to make you believe, deep down, that you were truly going to live through this. It is easy to dismiss this as superstition, drums, feathers, and chanting, but here's the twist you missed. Modern science has confirmed something shamans understood intuitively. Belief is medicine. The placebo effect is not imagination, it is measurable. It changes hormone levels, it changes immune response, it changes how your brain processes pain. When you expect to heal, your body actually heals faster. Inflammation drops, endorphins rise inside the bloodstream. Studies show ritual performed with conviction can trigger real biological change. The shaman's chant delivered pure hope. Hope, it turns out, is a chemical. Ancient healing was woven into meaning. Sickness was never random, it was a story. Your spirit out of balance, ancestors unhappy, A sacred taboo had been quietly broken. To get well, you fix the story. The ritual gave you something modern medicine often forgets entirely. A reason, a narrative, a path back from the chaos of being ill, lost, and terrified beyond comprehension. Around that, real pharmacology was happening. The shaman knew which bark eased fever, which root induced vomiting, which leaves you pressed against a wound, which mushroom calmed a seizing child in dark night hours. In many traditions, one healer could identify hundreds of medicinal plants. That is a doctorate of memory. The chant did one more thing. It calmed the patient, slowed breathing, lowered hormones that suppress immunity. A frightened body fights infection badly. A soothed body fights well. Drums tuned the nervous system itself. But one ancient instinct beats every ritual we've invented. Stay close. The next part reveals it all. Your body already knows what to do. When sickness hits, you feel terrible. Aches, chills, the urge to vanish. Most think these are symptoms of disease. They are not. They are weapons. Your body is fighting back hard. Fever is not a malfunction, it's a strategy. Higher core temperature makes bacteria and viruses struggle to reproduce inside. It also speeds up your immune cells. Studies show suppressing fever too early can make infections last much longer. Vomiting and diarrhea aren't just suffering, they're ejection. Your body is dumping cargo it believes is genuinely dangerous. Sleep isn't laziness. During deep sleep, your immune system surges. Cytokines rise. Repair accelerates. Your system forces shutdown. Scientists call this sickness behavior. It's ancient, older than our species. Chimps do it, mice do it, even insects. Animals self-medicate too. Chimps in Tanzania chew bitter leaves to expel parasites. Bears dig specific roots after hibernation. Elephants travel miles for clay deposits. Pregnant lemurs nibble bark to ease labor. Humans inherited the same ancient impulse. There's a strange practice called geophagy, eating clay. It sounds absurd, but studies show certain clays bind gut toxins. Pregnant women in traditional cultures eat specific clay. Animals too. Your ancestors did the same. Pharmacy under their feet. Your body still runs Stone Age code. You crave salt after sweating. You lose appetite during illness. When you cannot stop sleeping. When you want a warm, dark room. These are not bugs, they are features, coded into you by hundreds of thousands of years of survival. Which raises an uncomfortable question about modern medicine. We think of ancient medicine as primitive. Magic, guesswork, bad outcomes. But look closer. They had real pharmacology, working plant-based pharmacology. They had surgery, real, sometimes successful surgery. They had psychology, ritual that engaged the placebo system, before anyone named it. They had public health, the instinct to isolate the sick, bury the dead with care, and keep water sources clean. Ancient medicine was not magic, it was data. Slow, costly, hard-won data. Imagine the first human who tried a plant and died. Then the second, who tried less and survived. Then the third, who tried a different part. Across thousands of generations, that experiment ran in every valley. By the time written history begins, humans had already tested most of the plants in their environment. Here's the twist. A huge share of modern drugs trace back to prehistoric experiments. Aspirin from willow bark. Morphine from poppy. Quinine, the first antimalarial, from cinchona bark, used by Andean healers long before Europeans. Digitalis, a heart drug from foxglove, used by folk healers for centuries. Artemisinin, our best modern antimalarial, from a plant Chinese physicians described 2000 years ago. Ancient data, slowly distilled, still healing us today. Penicillin was discovered in a lab, but ancient Egyptians pressed moldy bread onto infected wounds long before antibiotics existed. They didn't know about fungi or chemistry, they knew it worked, wrote it on papyrus, and passed it on. Their hands were on the same chain you are holding right now every single time you swallow a pill. Here's the deep truth. There has never been a moment when humans had no medicine at all. From the first hominid who chewed a bitter leaf and felt better, healing has been a defining human skill. We are the species that takes care of the sick. That isn't a luxury, it's what made us human. So what does this mean the next time you actually get sick? It doesn't mean throw away antibiotics. Modern medicine saves lives our ancestors couldn't, but the older toolkit still works and we forget it. When fever climbs, remember it's a weapon, not a malfunction, a tool your body chose carefully. When fatigue floors you, that's the treatment, not the symptom. The urge to rest is ancient. When you reach for the people who love you, studies show strong social ties measurably speed your healing. When a familiar ritual makes you feel safer, that's your placebo system, the one shamans were quietly hacking. Belief becomes chemistry. The trick isn't to romanticize the past or dismiss it. Treat it like a healer would, carefully, with curiosity. Because one mystery still haunts every archaeologist who studies this, and it's coming next. How did they handle the invisible illnesses, the sadness that would not lift, the voices in the head, the grief that became sickness, the fear that became fever? What did ancient humans do when the mind was wounded? The answer is even stranger than trepanation, and it is the next thread we will pull in our story. If you want to know how prehistoric humans treated madness, mourning, and the broken mind, that story waits next. And here is a question for you. What is the oldest remedy your family still quietly uses at home today? Honey for a sore throat? Saltwater gargles? The strange tea your grandmother made when you were small? Write it in the comments below. You might be carrying a piece of medicine older than any modern pharmacy. If you like deep dives like this into the hidden history of being human, you know what to do. Stay close to this channel. The next discovery is even stranger than trepanation itself.